If your child is hyper-focused on the subjects of interest, prone to anxiety, easily distracted, sensory processing issues, trouble following the instructions, these are the symptoms of ADHD as well as autism. So we cannot say that the child is suffering from ADHD or autism. So what are the differences between ADHD and autism? For autism, we have very restricted interest, but for ADHD, loses interest easily. For ADHD, we have issues keeping track of time, they like things in order. They don't think about the time at all. But autistic child has the specific thing that you can identify it easily. They avoid eye contact or physical contact. Okay, but in ADHD, it's not. In autism, a child finds it hard to have conversation. You find it hard to stop talking, to not interrupt, and often messy. So why they are similar and why they are different? So in both of the ADHD and autism, we have the challenges with executive functioning, or we have sleep issues. Not always, but mostly we have sleeping issues or difficulties emotional regulations. On the other hand, ADHD is neurodevelopmental disorder that affects concentration, attention, and impulsivity. And ADHD prefers changes, become this because the same thing becomes very bold. They get bored with the routine and get very impulsive. But in other hand, autistic child prefers a structured routine. They can be very upset during the changes. So these are the basic differences between autism and ADHD. So here the question that lots of mothers ask from us, the intervention of ADHD and autism always varies depending on the severity of the condition. Behavioral therapy can help with both of these conditions, or occupational therapy can also help, and speech therapy can also help. Sometimes what happens, the ADHD is comorbid with autism, or joined with autism, or autism joins with ADHD. So what we think, or what we decide after the evaluations, we decide that either the ADHD therapy will work for the child better than the autistic therapies, the therapies for autism, or autism therapies will work better for the child more than the ADHD therapies. So please, if your child is suffering from these issues, doesn't have eye contact, emotionally drained out, cannot express the emotions, cannot express the feelings, or have the eye contact but a very limited eye contact, only the eye contact with those people, those he knew it, and cannot have the eye contact with a stranger, cannot meet, cannot talk. If your child is having these issues, please get evaluated. Thank you so much. I'm Arjuman Raza from Help for Kids and Adults, South Africa.